Hey everyone, Alexa here from NP2Go. I'm one of the nurse practitioners and I will be answering some questions about men's hormones. So men can have low testosterone for multiple reasons. Now, naturally, as men age, the testosterone that we produce is decreased. Now, things can absolutely affect that earlier on in life than we typically would imagine due to sometimes increased weight. There could potentially be some underlying issues as well that need to be tested a little bit further for why, especially if you're in your 20s or so and you're testing low for or you're testing for low testosterone. There could be some underlying reasons that would be low. Typically, we start seeing decreased testosterone, in your 40s, 50s or so, and I have a lot of men that usually tend to start on testosterone replacement about that time. Some of the symptoms that you can experience when men's testosterone is decreased is energy levels, libido, ability to, have an erection during sexual activity. All of those things can be heavily affected with decreased testosterone. And typically you're going to see men that are just, man, I just don't have the energy like I used to. I don't have the libido like I used to. I just feel way more bogged down. Men's hormone levels can absolutely be affected by stress, decreased sleep, all of those things. If you are very stressed out and your body is just not reacting appropriately, all of those heightened cortisol levels can really affect how your body produces your testosterone. So usually we're saying make sure you're getting enough sleep, make sure you're eating correctly. Unfortunately, in general, the heavy preservatives in foods and a lot of the processed foods that we have can heavily affect your ability to produce hormones. We see that in women and we do see that in men as well. Lifestyle changes can absolutely boost your testosterone. Really, the things that you're going to see mostly are with weight loss, with eating right, decreasing your amount of alcohol. If you are, have any kind of illicit drug use, anything like that can absolutely decrease the testosterone levels. Substance abuse with hormones across the board, and really a lot in men are, if we're doing illicit drug use or any kind of alcohol, a lot of the times we can see a decrease in testosterone and sperm count for that reason. If you're really looking at increasing, obviously testosterone in general, usually men that are on hormone replacement aren't looking at sperm counts because if many men don't know this, but if you're taking testosterone, it will drastically decrease your sperm count. So do not be on any kind of hormone replacement therapy while you are trying to start a family or have children. To maintain healthy hormone levels as y'all age, honestly, being active. The best thing you can do is just routinely being active. And it doesn't mean do, 2 hours of a gym sesh, 5 days a week, 6 days a week. It could be as little as, okay, let's, do a good walking for 30 minutes. And then yes, lifting and truly building muscle is absolutely going to help. And it doesn't mean you need to bulk up significantly. It just maintain muscle and build good lean muscle, as well as just a healthy diet. And healthy diets are going to be more towards whole foods. Try to stay away from the heavy preservative foods or the high processed foods because that tends to be the biggest factor of really decreasing that testosterone. Biggest differences between men and women and hormone replacement therapy, especially as, we're told men and women should, maybe experience the same symptoms, and that's not the case. Women are going to see those decrease of estrogen, testosterone, and progesterone over time. Really what we're looking at with men is testosterone. And because estrogen, yes, we want men to have estrogen because that is actually going to give them the benefits of, lowering your cholesterol, preventative care. Healthy levels of estrogen can actually help promote a decreased risk of prostate cancer, breast cancer happening in men, and so forth. So there are reasons that we obviously want to check your estrogen as well, but testosterone will naturally change over to estrogen and help increase your estrogen levels without actually giving men estrogen. So just keep that in mind. But really the biggest differences between men and women, they're different. Men and women are made completely different. Their side effects from having low testosterone and low hormones in general are very different. Overall, women tend to experience more brain fog, more irritability, more just overall, just not having the energy levels. I will say they also have an increased risk for side effects when we're replacing that testosterone. Typically with men, when you add the testosterone, very few men will have all these bad or all these potential side effects with the elevated testosterone. testosterone, like hair growth or hair loss or irritability, a lot of the times it's more on women. So typically when we are replacing men's testosterone, they will have, it's a little bit easier and they have less of a barrier to get through to start really seeing results. Women, it's a little bit more of this before we find an even keel way of making them feel better. One of the biggest things I want to debunk about men's hormones replacement is the anabolic steroids and testosterone replacement are two very different things. Testosterone is actually a scheduled substance. A lot of y'all may not know that, but it was because of rules and regulations throughout sports that testosterone became a scheduled substance. They wanted it to be monitored so people didn't abuse it. Well, they are not the same as anabolic steroids. Testosterone that we replace is bioidentical. It is the testosterone you naturally make in your own body to begin with. Anabolic steroids are very synthetic and do a lot of damage to your body.